Good morning, everyone. So, anyone who follows me knows that my focus is not about living a healthy lifestyle just to lose weight. However, I do believe that that is a reason that factors in for many of us, myself included, and there's nothing wrong with that at all. I think if that was our only why for creating lifestyle changes, then that will make it much more difficult to make the changes sustainable. However, I think, there's nothing wrong with including that as part of it. So, for myself personally, I really want to create a healthy lifestyle so that I have the energy and the physical ability so that I can do the things that I want to with my family. I want to be able to travel. I want to spend time with friends and be able to also continue to work with helping other people be able to feel their best. And I want to be able to feel great and comfortable wearing a bathing suit as well. So, today I just wanted to talk about how eating to keep our blood sugar levels stable is important for everybody and additionally will help us burn body fat more effectively. So thank you so much for joining. Hi, Mark. My name is Dr. Jennifer Hessler. I'm a naturopathic doctor and a mom of three, and I'm passionate about helping people understand how they can eat healthy more easily, exercise, manage their stress, and also help their bodies function optimally so that they can go on to do all of the things that they want to be able to do with their lives. So today, like I said, I'm going to talk about how you can eat to keep your blood sugar level more balanced and why I believe that's so helpful. So I'm going to begin just by talking a little bit about basic physiology. Whenever we eat a carbohydrate, it gets digested and then gets released into our bloodstream as sugar. So carbohydrates include things like fruits, vegetables, grains, things that contain sugars, so honey, maple syrup, obviously refined sugar. And some foods, of course, will have more sugar than others and will create more of a release than others. But all of these things do, one way or another, get broken down into sugars. So what then happens is that signals to our pancreas to produce insulin. And that insulin then binds to receptors that are in the outside of our cell membranes and opens up these glucose or sugar transport channels that are in the cell membrane. So that allows the sugar to get into the cell where it can then be used to produce energy. So it's a very important way for our cells to get energy and for us to also have energy as well. So what happens in some cases, either because we're eating too many sugars in our diet, too many carbohydrates, or genetics definitely play a role in it as well. But the insulin doesn't bind effectively to those insulin receptors. And because of that, our pancreas has to produce more and more insulin in order to still maintain regulated or lower blood sugar levels. So if we're eating lots of carbohydrate-rich foods, then we are going to be stressing out that part of the system. So, and the other side effect of that is that your body will also hold on to body fat. So it's not getting the signal that it's okay to burn that fat for energy because it wants to hold it up as a backup way to have that fuel source. So that's why in clinic I will often check blood insulin levels after someone has had a sugar challenge to see how much insulin they're having to produce in order to deal with carbohydrates. And that's especially important to look at when somebody has been making healthy lifestyle changes, but they're still having a really hard time losing weight. In clinic, I often do body composition testing, which tells me how much muscle mass and body fat and a bunch of other parameters a person has. And if I see that somebody's got a really good muscle mass, but their body fat percentage is proportionately a lot higher, that is a big red flag that there's some insulin resistance going on. So, and then things like stress and hormonal changes like menopause or an imbalanced thyroid can also create or stop that insulin regulation from happening properly. So what kind of diet can help with this? Well, generally you want to eat a diet that's higher in protein and healthy fat, as that slows down the rate that carbohydrates get digested. So if we combine the carbs with fat and protein, we're going to get a more steady release of blood sugar. And that so then the levels don't spike as much, which means that we don't need to produce as much insulin. It's also helpful to eat fewer grain-based carbohydrates. Trust me, nobody is going to be deficient from not eating enough bread. I'm not saying you don't ever eat bread, but we really don't need to have it on a regular basis. It's better to use things like coconut flour or almond flour, which have protein in them and some fat in them, and will have a more stable blood sugar response. It's also helpful to eat less liquid dairy. So liquid dairy, things like milk or animal milks and cottage cheese have sugars. They have whey protein in them, whey, which can act as a sugar in them. And so it's better to use unsweetened non-dairy milks instead. It's helpful to eat fewer potatoes, as those are a starchy carbohydrate, which can raise blood sugar. And also, this one is kind of common sense, to eat fewer refined sugars. So there are more specific things that I would discuss treatment-wise in clinic if somebody actually has insulin resistance. However, eating according to those guidelines is something that is helpful for everybody to generally follow. If we keep our blood sugar levels stable and our insulin response prevent it from getting too high, we're going to have more energy, we're going to have less inflammation in the body, and inflammation fuels pretty well all chronic disease. We're going to have more balanced hormones, so it's going to help our thyroid and our reproductive hormones work more the way that they're supposed to, and it will tell your body that it's okay to burn body fat. So you're going to see much more effective results in that area from doing the other things like stress management and exercise that are also important when we're looking at living a healthy lifestyle. So those are the principles that I use when I create the meal plan for my online program, which is called Your Best Life. And that's definitely the part of it that people find really, really helpful, to see that eating according to these guidelines, having more protein, more healthy fat, eating fewer grains, eating less dairy, it's still possible to have really good tasting food that is not difficult to prepare, and to see how great you can feel when you do eat that way. And also for your family too. The group that's going through right now, I've had several people comment that even the picky members of their family are jumping on board and really enjoying eating that way. So if you'd like to give it a try, I do still have a few spots left for the January 23rd program, which will start, it starts next Monday. Registration will close on Friday. So I would love for you to snag one of those spots before it does fill up. If you have any questions, feel free to ask me about it. There's lots more that I touch on beyond just the clean eating, but that is something that many people do find really helpful. So thanks so much for listening. I hope that the information I've just talked about provides some food for thought, and I will talk to you soon. Thanks so much, everybody.